Good morning, everyone. I hope this finds you all well again and getting weller. Those of you that are going through some tough times, hang in there. That's all I can say is hang in there, keep ripping it apart. Know when you need to pull back or when you need to get more aggressive. And generally, I think more aggression is at hand. But again, sometimes you have to know when to pull back. But good morning, good morning. Is that not a beautiful card? Is that not a just gorgeous card? Boy, the beauty of that is just incredible. All these beauties that we find on the planet, and lots of love to you all. I don't know whether I should mention any names here, and thanks a lot for this beautiful, beautiful card as well. I'll say this card came along with this picture. Look how beautiful that is. What an artist. And that, of course, is little Coco. Is that not beautiful? I tell you, you're a good artist, and thank you. Hugs and kisses to the whole family for this. That is just unbelievably sweet. It captured all our hearts here. Beautiful artist, great eyes. Thank you. I can't. Thanks. I thought that I've got a couple of things here that are very, very important to you. But again, thanks so much for your love. It is not unappreciated. It is immensely appreciated. This is Wayne Douglas Archer. I don't know if you guys saw this post. I don't think you did. This came through the email or something. I don't know if it made the post on the net, but this is a detox crisis. This made my heart sad. I have been treating my granddaughter since she had a seizure, which combined with cutting off oxygen to her brain. She was born with a genetic disorder causing brain damage. So after months of detox, there was steady progress. Then almost suddenly mucus began coming out nose and mouth. Now you know in detoxification that is going to happen no matter what. I was talking to a medical doctor over the weekend of another young man, just sad case, real sad case. And this medical doctor had already started him on a type of insurer, even though the mother was vehemently opposed to it because she's already been through all that. And I told the medical doctor if she wasn't careful, she was going to give this young man pneumonia, which ended up doing. And then if they treat it for pneumococcus with antibiotics, which is just a mucus condition, then they could, this child is so advanced in his problem, they could go ahead and terminate this little boy's life. And I don't know how much she appreciated that, but she needed to know that because she's going to see that happen if she's not careful. I told that to another medical doctor, an ER doc, once about a quad I had in the ER. She had so much mucus she couldn't breathe. So we had to run her to the ER because in a quad, mucus builds up in these lower chambers real thick. And the longer that mucus is in the body, the more anionic it gets, the more thicker it gets, the more coagulated, agglomerated. And so this is what happened. So I told, don't give her antibiotics. He did and killed her. She died 3 times on them. They finally stabilized her, put her in another hospital to die. The parents finally, we got a quarter, grabbed her, took her home, and got a suction machine, and she did well. I mean, she's the one that C3, C4, total reconnection of the nervous system. Almost suddenly mucus came out of nose and mouth, and she had trouble breathing. Upon rushing her to the hospital, and this is the problem right here, she was getting a lot of this mucus out of her, and that's detox. That's the problem. A lot of mucus in, a lot of mucus out. Well, of course, people freak out. Of course, it does give you a little shortness of breath. That's why a suction machine, that's why you have pulmonary. That's why you have pulmonary division in your hospitals to do nebulizing treatments, suction machines, and everything else. But they rushed this little girl right up to another hospital. They flew her to a large children's hospital. That's scary right there. They used antibiotics to control the mucus. Well, right there was the worst thing that medical doctors could have done. That's where you bridge from a lack of understanding to almost insanity. They gave her a CAT scan. Okay, so here we go. We got another CAT scan where 300, what's a CAT scan? 300 x-rays, subtract that by about 0.6, 0.7 rads per x-ray. You're at about 150 rads. Nobody shoots 150 rads except CAT scans. It's what makes them so cancer causing. And you did that of the brain. I was shocked. She is 10 years old and breathing on her own. They started that because of brain damage. It would be best to have her pass or killed than to continue with her 24-hour care. This is what I assume they told the parents. Do brain cells regenerate? Absolutely. Need to hear some other opinions? Absolutely. This I thought was an incredible case. One where these type of cases are so far out of the reach. Most cases are, no offense, but this particular case way outside of the medical realm. I think that medical doctors should only be allowed to stabilize in the emergency room while we come in and clean up the job. It's what medical doctors don't understand is our level of expertise in health and nutrition. This medical doctor thought she knew more about nutrition. I said, no, 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 honey. We know far more than you ever thought about when it comes to nutrition and chemistry and how all that is. And she was taught basic fundamental chemistry, I'm sure. And that's where you run into major problems. Trying to understand through chemistry, through the anionic and cationic factors, through the balances, through the zeta potentials, through this ionization process, bad or good, and the movement of electrons between the cations and stuff. It can get really out there, and there's so many theories. There's Schultz's and Hardy's, and there's all types of theories out there in biochemistry and in chemistry. And I just have to say that sometimes chemistry doesn't always fit when you look at observed clinicals, because there's just so much to understand in that movement of electrons and the changing of the potentials and the magnetic bonds and things like this. So really, really difficult. I'll put it that way. There's a lot of thoughts out there on this, but the bottom line, and again, we'll talk about this in the school, the simplicity of this whole thing and keeping it that way, because there's just too much disagreement, and that's problematic. So yes, absolutely. This is the case where if it was me, I'd be using upper circuit, brain, and nerve. Absolutely. Heads down, full of mucus. The body's trying to clean this out. You can't regenerate brain tissue when the brain is full of mucus. That's the problem. This suppresses interstitial drainage. This creates this anionic or agglomerated medium, a coagulated medium. This sets up acidosis, and then of course with acidosis, then you have the potential of the destruction of the cells. And so inflammation and swelling minimally, etc., 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 etc. So I find this case exciting for her potential to come back. Definitely fruits and berries and the melons are the only thing you would want to serve this little 10-year-old, and in a children's hospital, she's probably getting all the pedicures and all this crap that'll only serve to give her more mucus. I mean, this is, the high stupidity of this is unbelievable. This is the problem. And so the parents are going to have, she's 10 years old, so the problem with this is the state can override the parent and say, get out, and we're controlling your kid. And it's just, we have some serious ethic problems like that, where the narcissistic views of the allopath claims that if you don't go our way, then we need to take your kid. This is that power we were talking about of the World Bank, Rockefeller syndromes, where we'll power you out, we'll fill you full of fear, or we'll create such a power here that you won't have a choice. That kind of thinking needs to be buried, if you know what I mean about buried. So, if they don't hurt your granddaughter, my friend, I would try to get her out and then keep on going with detoxification. Again, you're going to see this mucus present out of the nose, out of the mouth, out of the stools, out of the kidneys. That would be essential. So sad that situation. I would say in the 21st century, if a medical doctor doesn't understand the mucosa and the mucosic response called mucus and all this, what the hell is he doing as a doctor? This is way past the time. This kind of information was presented back in the 1900s. So you can see over 100 years here, and they still don't get it. Amazing. This is from Owen. Hey, Owen Fox, good friend, man. Robert, is sulfur rendered harmless or destroyed when we cook it? Well, here's the problem when we cook. You see, this is all the chemistry bonding again, where we open up magnetic bonds and we create new magnetic bonds. This is the problem with cooking. So I don't know what to say to that. I can say that a lot of the chemistry we consume when it's bonded, luckily, can't be absorbed through the intestinal wall because it's too big after bonding. On the other hand, obviously there are proteins and free radicals that are absorbed that now the body has to deal with. So this is all part of how chemistry works, but at the same time, man wasn't supposed to cook his food. So I don't know, you say that, but at the same time, man did cook his food. But I think you see the decay of the human cell at the point now that it's unreal. So hopefully in this 10-year-old you can regenerate that tissue. I certainly wouldn't give up hope, and and this is where our little friends, the fruits, the berries, and the melons, and the herbs come in here and really help this young girl, especially with the upper circuit, brain, and nerve. You still want to go after the kidneys, the lymph system, the GI tract, because you saw that mucus coming out of her head. That was the best thing that could have happened to her. The fact that there was panic and sent her to the hospital, and they panicked because of the mucus, is just kind of sad. This is another one. This is EUCE 747. Hey guys, how you doing there? My dad is very sick. He was in the hospital about 3 years ago for a whole year. Holy crap. I'd like to have seen that hospital bill. Holy moly. I mean, for a 2-hour stay, it's about $9,000 down here at one of our rip-off hospitals. And so figure that one. Holy crap. Of which he was in a coma. Look at that. Had C. diff and almost died. Oh. With all blessings to God, he lived, but his health has basically plateaued and started to go downhill again. Most of this is due to bad information from his doctors, poor eating habits prescribed by his doctors to not eat potassium or phosphorus. Well, kidneys right off, I can tell you. Phosphorus and potassium, he was in kidney failure, obviously, and so this is what you were seeing with the phosphorus and the potassium. These guys do freak out with that a lot, which eliminates most fruits, veggies, and leaves just meat, rice, and etc. All these dialysis patients, guess what they get? Fruits, berries, and melons. Thank you. I don't care about the phosphorus and the potassium, although we allow them to use the binders and things just to stabilize and keep moving. But at the same time, man freaks out too much. He doesn't understand what the natural side is doing coming into the body with its full-bore chemistry. And so they just don't understand how that changes the cationic and anionic processes and the ionization processes, etc., etc., etc. Whew. Can't say I do either. I mean, we're still working again in theories here in chemistry and physics and stuff like this. So theories is simply a postulate, an assumption, given by a set of circumstances viewed through a conditioned mind. That's why spirituality is lost in the intellectualism, because you can't expand your consciousness. You're isolating it, trying to figure out how the isolates work and bond together with the cofactors and etc., etc., etc. Because of his stay in the hospital and the large doses of continued antibiotics, my God, these guys have a major fetish with antibiotics, don't they? I believe his kidneys are very damaged. Well, they already were, my friend. I can just tell you. He was on there you go, dialysis. That's why the potassium and the phosphorus there.